Ben is our middle son. He's 16 now. He suffers with severe autism. He was diagnosed when he was 18 months old. He's been at the Shires since May 2011.
When he was 10 years old, it became clear that we weren't going to be able to cope with him long term, and he needed specialist care. And we kind of took the decision at that point that it needed to be a residential specialist care.
It's a really hard decision because a lot of people think that you're failing as parents, but it's not like that. It's about getting the best possible outcome for your child. We wouldn't have survived if we'd kept him at home with us. We would have given up, wouldn't we, and gone under.
Well, I think that's probably the case. We would. I don't know where we would be now, but it certainly wouldn't be at this point.
He had severe challenging behaviour, so it wasn't just the autism. It was the behaviour. He was punching us, kicking us, pulling our hair out. We were beaten, weren't we? We were beaten down emotionally and physically. We just couldn't have done it any longer. With the Shires, what they do is they don't think about what the child can't do, which a lot of people do, focus on what they can't do. They always focus on what they can and try it and see if they can, but they never just assume that they can't, and I think that makes a big difference as well.
They know what they're doing. That's the thing.
Very experienced.
Yeah, they just do know what they're doing, and it's harder to put it in any other terms than that. But we've had instances where he's come home for the weekend and something's gone wrong or for whatever reason, and they're straight into a help. So even when he's not there, they're always on call. Nothing seems to be too much trouble for them. I think that's the critical thing.
For us, it's peace of mind. We know that they can handle any situation and we don't worry about him anymore. Before, he was in a local authority placement and we worried about him every single day, but we don't worry now. We know that whatever he brings on that day, they will cope with, and we've got peace of mind, and we've never had that, have we?
No, I think that it comes back again to the same old thing, is that they know what they're doing for this particular range of children. It's not just sort of like the one person at the top. You can see it all the way through through the staff.
Nothing's too much trouble, is it? Nothing. Whatever needs to be done is done, and they just get on and deal with it. Little things that don't mean much to other people, but you say, Ben, will you put that in the bin? And he'll go and do it, and you think, wow, that's amazing, he's just done that. Or when he'll get out of the car at a new place that he hasn't been before, that's progress. Or drinking, he always had a lidded beaker, drinking from a normal cup, that's progress. Using a knife and fork, progress. There's loads of progress, isn't there?
Yeah.
He's even started shaving now, so that's progress too, because that's a big, big thing.
We know he's in the right place. He's, sort of like you get lots of photographs back from the Shires, you get lots of film back from the Shires showing what he's done, and he's always happy. We kind of know that he's doing all the good stuff, as well as the educational stuff and the social skills. We know he's having a really good time as well, and that's really important to us.
It's changed his life, it's changed our life. Although he can't tell us, we know that he's happy.